Welcome students to Chapter 15, which is on personality disorders, and we'll touch on each of these that are in the DSM in this chapter. First, though, we're going to take a look at some terms so that you can differentiate them. Personality is considered to be uniquely expressed characteristics that influence behaviors, emotions, thoughts, and interactions. Personality traits are those particular, predictable, flexible characteristics that people have, like kindness. And a personality disorder is different from those kinds of things because it becomes an enduring, rigid pattern of both inner experience and outward behavior that leads to significant problems and psychological pain for oneself and others. And that's what we're talking about today. So the checklist for personality disorders is where an individual displays a long-term, rigid, and wide-ranging pattern of inner experience and behavior that leads to dysfunction in at least two of the following realms: cognition, emotion, social interactions, and impulsivity. The individual's pattern is different from ones usually found in the culture of origin, and individual experiences significant distress or impairment as part of this pattern. Symptoms tend to last for years. They typically start in adolescence or early adulthood, and they are among the most difficult psychological disorders to treat. About 11% of the U.S. population has a personality disorder at some point in life, and there is lots of comorbidity with other psychological disorders. This DSM-5 identifies 10 personality disorders in 3 categories or clusters. The first one is odd or eccentric behavior, which is cluster A. Then we have dramatic, emotional, or erratic behavior in cluster B, and anxious or fearful behavior in cluster C. We'll look at each of the disorders under those. The first odd personality disorder cluster consists of paranoid, schizoid, or schizotypical disorders. People with these disorders display behaviors similar to, but not as extensive as schizophrenia. Few people with these disorders seek treatment, and so treatment success is limited. Paranoid personality disorder is the first one. It's characterized by deep distrust and suspicion of the motives of others. There are limited close relationships and close and distant affect. There's excessive trust in one's own ideas and abilities and critical thoughts of weakness and fault in others. It's experienced by about 4.4% of U.S. adults. The treatments involve the psychodynamic approach and also the cognitive behavioral approach. In that group, people will look at anxiety reduction and interpersonal problem-solving improvement, and they will also try to develop more realistic interpretations of the words and actions of others in the client. The biological group, of course, has antipsychotic drug therapies. The next type of personality disorder is a schizoid personality disorder, which is characterized by a range of interpersonal problems marked by extreme discomfort in close relationships, very odd patterns of thinking and perceiving, and behavioral eccentricities. These folks are noticeably disturbed. They have ideas of reference, bodily illusions. They have perceptions of extrasensory abilities or magical control over others, and they have attention-focused problems. It's present in 4% of U.S. adults. Treatments involve helping clients reconnect with the world and recognize the limits of their thinking and powers, increase positive social contacts, ease loneliness, reduce overstimulation, and increase awareness of personal feelings. We also try to teach clients to evaluate their unusual thoughts and perceptions using specific behavior methods and antipsychotic drugs. Schizotypal personality disorder is characterized by a range of interpersonal problems marked by extreme discomfort in close relationships, odd or bizarre ways of thinking, and behavioral eccentricities. Individuals believe unrelated events do pertain to them in important ways in this disorder, and there are bodily illusions. Folks have difficulty keeping their attention focused. Their conversation typically digresses and is very vague, may even have just very loose associations that don't connect to anything, and it affects 4% of adults. Treatments involve the behavioral approach, helping the client reconnect to the world and recognize the limits of their thinking. Cognitive behavioral theorists will help people recognize unusual thoughts and magical predictions, give speech lessons, social skills training, and appropriate dress and manners recognition. The biological group will give low-dose antipsychotic drugs. The dramatic personality disorders is the next group. This is a cluster that involves the antisocial, borderline, histrionic, and narcissistic personalities. And these people are very dramatic, emotional, or erratic, which makes it almost impossible to establish relationships with them. Their disorder causes are not well understood, and treatments are ineffective to moderately effective. The first type is arguably the most problematic of all personality disorders, the antisocial personality, involving psychopaths and sociopaths. People with antisocial personality disorder persistently disregard and violate others' rights. A person has to be 18 years of age to receive the diagnosis. These people lie repeatedly, they're reckless and impulsive. They have little regard for other individuals and can be cruel, sadistic, aggressive, and violent. They have higher rates of alcoholism, substance abuse, and then they also tend to start out life with childhood conduct disorder. This is found in 3.6% of U.S. adults. Treatments involve education, therapeutic community, and psychotropic medication, and it's typically ineffective because these people don't have a conscience and they lack a desire to change. So they don't even really show up for any kind of treatment unless it's court-ordered most of the time. Borderline personality disorders also can involve psychopath or sociopathic behavior. It's characterized by instability, including major shifts in mood, unstable self-image, and impulsivity. There's an unstable, intense, and conflict-ridden interpersonal pattern of relationships. They are prone to bouts of anger that sometimes involve violence, and they also may direct that inward and harm themselves. 70% attempt suicide and 10% die by suicide. This is found in 6% of U.S. adults, 75% of which are women. Treatments include the psychodynamic approach, the cognitive behavioral approach, which is primarily dialectical behavior therapy. It's a very well-supported treatment. And then the biological group will prescribe different drugs such as antidepressants, antibipolar, anti-anxiety, or antipsychotics. Histrionic personality disorder involves individuals who are extremely emotional and want to be the center of attention. They're always on stage. They really have to have approval and praise. They can be very vain, self-centered, and demanding. Some make suicide attempts, often to manipulate others. This is found in 2% of U.S. adults. Treatment involves cognitive behavioral therapy, at times which focuses on lack of substance and extreme suggestibility found in people with the disorder. So their general assumption of helplessness to care for the self is addressed so that they will seek out others who will meet their needs. Psychodynamic therapy and group therapy is used. Each approach is useful, though some are less useful. Narcissistic personality disorder involves grandiose ideas of one's worth. There's a need for much admiration, and there is a lack of empathy for others. So it is similar to the antisocial group, except that the antisocial group is much more aggressive. These people exaggerate their achievements and talents. They're often seen arrogant. They're selective about friends, often favorable. First impressions are gained by seeing them. Some make suicide attempts, often to manipulate. This is common among normal teenagers because of that developmental phase, and it doesn't usually need to lead to an adult narcissism, fortunately. It's found in 6.2% of U.S. adults and is more predominantly men by 75%. Treatment involves clients consulting therapists, usually because of a related disorder, most commonly depression. These individuals may try to manipulate therapists to support their sense of superiority, and so a love-hate relationship can evolve. The psychodynamic group recognizes and works through basic insecurities and defenses among these people. The cognitive behavioral group focuses on self-centered thinking and redirection. No major treatment approaches have had much success, though, again, because of the lack of empathy, it creates a problem. Anxious personality disorders is a cluster that involves avoidant personality, dependent personality, and obsessive compulsive disorder. People with these disorders typically display anxious and fearful behaviors. Research is limited in terms of what works. We do know that the avoidant personality disorders are characterized by consistent discomfort and restraint in social situations, overwhelming feelings of inadequacy, and extreme sensitivity to negative evaluation. There's a fear of close social relationships for the social avoidant ones. In terms of that contrast with social anxiety disorder, those people are more just fearing social circumstances. So the two disorders may reflect a core psychopathology, and there is some thought that they should be combined. At least 2% of adults have avoidant personality disorder. Treatment is often sought for acceptance and affection. A therapist gains the individual's trust and tends to treat the disorder in the same way as social phobia and anxiety. Cognitive behavioral therapists use group therapy for practice in social interactions. Anti-anxiety and antidepressant drugs are sometimes helpful. Dependent personality disorder is where an individual has a pervasive, excessive need to be cared for. They tend to be clinging and obedient. They fear separation. They become distressed, lonely, sad, and prone to self-dislike. They rely on others, so the smallest decision cannot be made. Difficulty with separation is a central feature. This affects fewer than 1% of the population. Treatment involves a psychodynamic transference of dependency needs in that school of thought. Cognitive behavioral therapists often combine interventions such as assertiveness training, challenging and exchanging incompetence and helpless assumptions, and then the biological therapists use antidepressant drug therapy when the disorder is comorbid with depression. There is a group therapy format oftentimes. And last but not least, obsessive compulsive personality disorder is characterized by intense focus on orderliness, perfectionism, and control, and the resulting loss of flexibility, openness, and efficiency. There are unreasonably high standards for oneself and others, fearing mistakes. These people may be afraid to make decisions because of that. There's a tendency to be rigid and stubborn, difficulty expressing affection, and so relationships are often stiff and superficial. As many as 7.9% of the adult population is affected. Men are twice as likely as women. Treatment involves difficulty because most people don't believe there's anything actually wrong with them in this problem. They are unlikely to seek treatment unless they are also suffering from something like anxiety or depression. Individuals do, however, respond well to psychodynamic or cognitive therapies, and a number of clinicians report success with drugs such as selective serotonin reuptake inhibitors. That concludes an overview of the personality disorders, and I will pick up our conversation in Chapter 16.